It's the most challenging public health issue facing our generation. Obesity, the result of not just too much food, but too much of the wrong food and not enough physical activity. The fifth report of Queensland's Chief Health Officer, The Health of Queenslanders 2014, has found more than half of the state's population is overweight or obese. That's 2/3 of adults and 1/4 of all children.
It's very serious. In the last 20 years there's been a doubling of the rate of obesity here in Queensland, and unfortunately now we're amongst one of the fattest nations in the world. We're approaching the United States levels.
Queensland is facing an unprecedented surge of chronic disease: stroke, heart attack, diabetes, cancer and hypertension. Dr Young says the health system is facing an unrelenting burden unless everyone begins to take responsibility for their own health and fitness.
Unfortunately, it's not the medical community that can really make the difference. It's all aspects of society. So it's all levels of government, it's our food producers, it's our advertisers, it's our urban planners, it's every aspect of society that needs to work together to solve this.
Queensland's Department of Health is addressing the problem with its award-winning Healthier Happier campaign. More than just advertising, it engages individuals to discover their health age by using an online calculator and downloading an app that helps measure food intake and physical activity. Recipe cards and exercise videos are all freely available online to encourage people to change their behaviour. Workplace wellness programs promoting exercise breaks, staff gyms, standing desks and healthy food vending machines are also playing a role in educating businesses and their staff to be healthier.
We just need to look at what we eat every day. There's nothing wrong with occasionally eating those foods that we all know are unhealthy, but you can't have a permanent diet of those foods. You've really got to stick with the fruit, the vegetables, lean protein, fish, meat, eggs. You've really got to look at what you're eating and follow the Australian dietary guidelines. They're there for a purpose and they need to be adhered to if you're going to have a healthy diet.
Queenslanders drink more alcohol than the national average. But despite that disturbing fact, Dr Young says there is good news.
Unfortunately, Queensland has one of the highest rates of alcohol misuse, if I can put it like that, in the world. But we've got some early signs that it might be getting better in our younger men, which is great news. Still a long way to go, we're still amongst the worst, but at least it's trending to a better space.
That same age group of young men is also leading the way in cutting smoking rates among the 500,000 smokers in Queensland. Rates have been declining for both men and women and among teenagers.
The tobacco story is a fantastic one, and that's one we really need to learn from and use for other aspects of health improvement, such as the obesity epidemic. With all of the action that's taken with tobacco control over the last 50 years, we've seen some fantastic outcomes. And in Queensland, we're now down to only 14% of adults smoking on a regular basis. 14% though still means 500,000 Queenslanders, and those people are putting themselves at risk. We know that half of those people will die because of that smoking habit if they don't stop. So really we've got to continue doing the work we're doing. But all the things we've seen, every step along the way, every time we do something to improve our tobacco control, we see a reduction in the number of people smoking. So we'll be continuing all of those efforts.
Immunisation is definitely a Queensland success story. The 92% coverage is above that of the national average, and Dr Young is confident the state will reach its goal of 95% in the very near future.
Immunisation in Queensland has been a tremendous success story. Even recently, we've seen our rates go from around 90% up to 92%. which is wonderful, and we're well on track to head towards 95%, because we know 95% is the level you need for the most contagious diseases such as measles. Now, we're working so closely with all of the people involved in the immunisation world, so GPs who in Queensland do a fantastic job, and they get the vast majority of kids and get them vaccinated.
Life expectancy rates for Queenslanders are among the highest in the world, yet there is still a concerning gap between that of Indigenous and non-Indigenous people.
We need to work on those factors, so we've got quite a few programs in place to work with them to address those risk factors in that community. Then we also know that people who live in rural and remote Queensland, again, have life expectancies less than their urban counterparts.
Premature death rates are declining, as are those for major conditions and some cancers, yet our hospitalisation rates are increasing.
So we know that if we don't halt, in essence, the obesity epidemic, we'll see our hospitalisation rates continue to increase.
The burden of chronic disease is one we won't be able to carry or fund unless we act now to do what we can to improve the health of all Queenslanders.
Every single one of us needs to take personal responsibility for what we do with our lives, what we eat, how we exercise, whether we smoke, how much alcohol we drink, exposure to the sun in terms of risks of skin cancer. And of course, adults need to take responsibility, parents in particular, for what happens with our children.